Hi, I'm Dr. Laurie Wellman, and in this lecture, Neuroanatomy 2, we're going to build on the structures that we learned last week. Let's begin by looking at the medial side of the hemisected brain. Now, I want you to note that we're not quite on the midline here with the corpus callosum and some of the other structures. However, we can see we are very much in the midline based on the cortex. Let's just start by reviewing some of the structures that we can already recognize on here, like the parieto-occipital sulcus, the calcarine fissure. Obviously, we can see the anterior lobe and the posterior lobe of the cerebellum, as well as the nodulus here. We have our midbrain, pons, and medulla here. We can see the thumb of our temporal lobe sticking out here. Again, thinking about the sulci, we have our cingulate sulci, or sulcus right here, ending here in the marginal. We can see that cingulate gyrus right here. And of course, as I already mentioned, we have our corpus callosum right here with the different components. We can also see here the thalamus and the hypothalamus. So let's begin to put in some structures that we don't already know. First, we have the anterior commissure, and we can see that structure very clearly here. Let me click back so you can see that circle. We can see it very clearly here because the brain is not quite hemisected on that midline. We're just off the midline here. That really allows you to see the anterior commissure as it's going from the left to right hemisphere. We can also see the fornix here, which is a white matter bundle coming from the hippocampus, and it is the most inferior aspect of our next structure, the septum pellucidum. And the septum pellucidum is going to divide the left and right lateral ventricles. We can see the interventricular foramina here, which is the opening from the lateral ventricle into the third ventricle in which the CSF flows. And we can see the choroid plexus, which we see here on the roof of the third ventricle. And this is what makes the CSF. Here we have a sagittal CT, so let's see some of those structures here. It's hard to tell the anterior commissure. If I had to guess, I would say it was right here. The other structures, such as the fornix, the septum pellucidum, as well as the interventricular foramina, are quite easy to see on this midline image. Furthermore, we can see a little bit of that choroid plexus on the roof of the third ventricle. We're still on this midline view, but we've gone ahead and zoomed in on the thalamus and hypothalamus. So we can see here our thalamus, which is superior to the hypothalamus. We still have our corpus callosum here with the fornix and the septum pellucidum here. So let's start to identify some of those hypothalamic structures. First, we have the hypothalamic sulcus, which is the division between the thalamus and the hypothalamus. We can see that groove quite nicely in this midline view. The most anterior aspect is going to be the lamina terminalis. The floor is going to be the median eminence. We can see here a mammillary body. There are two, a left and a right. And finally, we can see the pituitary stalk. Of course, we can't see the pituitary here as that was left in the cranial vault. But here we can see that stalk quite clearly. Now let's talk about the structures of the epithalamus. I know that you recognize that that was on your sheet of structures to know. The epithalamus allows the limbic cortex to connect to other regions of the brain. Again, midline view here, and we can see all of those structures that we identified before. So let's add some more in. We can see the stria terminalis that is sitting pretty superiorly on this view of the thalamus, although we know that the thalamus actually extends even more superior, but it's what we can see right here, and it is inferior to our fornix, which we can see right here. At the most posterior aspect of the stria terminalis, we can see the habenula, or the habenular trigone. It's a little more difficult to see, so I've just put a star here in this image. Here we can see the pineal gland, which is responsible for making melatonin, which is really important for the circadian rhythm. And then inferiorly and slightly anteriorly, we can see the posterior commissure, again connecting the two hemispheres, the most posterior aspect of the third ventricle. Thinking about that third ventricle, we can see the cerebral aqueduct here, traveling from our third ventricle into the fourth ventricle, which we can see in a lateral view right here. Next, we're going to look through some horizontal brain slices. This is one of my favorite ways to look at the brain, as I feel like we can see so many more structures than we can see just from the periphery and that midline view. It's also very important because they correspond to the images that you could get back from CT or MRI, and we need to know where those structures are within our imaging. So I'm going to present to you a wet brain slice, and then I will present to you the corresponding CT image. So most superiorly, although there has been a slice taken off, we can see the cortical gray and white matter. Remember that the gray matter is most superficial towards the outside, whereas the white matter is going to be deeper within the brain. This is the exact opposite of the spinal cord, where we see our gray matter in the central location and our white matter surrounding that at the periphery. When we're looking at a horizontal slice like this, or a horizontal image on CT or MRI, we're going to call this a mass of white matter the centrum semiovale. Here's a CT image of approximately the same slice. Can you recognize the gray and white matter here? And here we have the labels. Now we've gone about 1 centimeter inferiorly, and we can see the lateral ventricles have begun in this slice. So we have a right and a left lateral ventricle, and then the roof and the midline we can see is the body of the corpus callosum. And remember, that's a huge white matter tract connecting both sides of the brain, or both hemispheres. Again, we can still note the gray matter and the white matter here. Here's a corresponding CT image. Again, can you see the lateral ventricles as well as the body of the corpus callosum? We've now moved another centimeter inferior, and again, the lateral ventricles have really opened up here. And this is where we start to recognize that there are different horns of our lateral ventricle. We have an anterior horn, or sometimes called a frontal horn. We have a posterior horn, or sometimes called an occipital horn. And then we have an inferior horn, sometimes called a temporal horn. So here we can really see the frontal horn, not quite as posterior as the absolute posterior horn, but we're certainly getting there. And we can see the body of the lateral ventricles quite clearly. So let's start putting some labels on this image. Again, the lateral ventricle. Here we're in the anterior horn of that lateral ventricle. I also want you to note the choroid plexus that's found in the body of the lateral ventricle, but it's not found in either the anterior or the posterior horn. We can also see the septum pellucidum separating the two lateral ventricles. Recall that on Monday, when I talked to you about the motor and sensory systems in their introduction, I talked to you about some basal nuclei. So here we can start to see several of the structures that are jointly called the basal nuclei. We can see the caudate, specifically the head of the caudate, which makes up one of the walls of the lateral ventricles, and we can see the putamen as well. In between these two structures, we have a white matter bundle called the anterior limb of the internal capsule. And this allows information or axons to travel to and from the frontal lobe. We can see the beginning of the third ventricle here just start to come into play. And we can see the corpus callosum splenium and the most posterior aspect here. Finally, we can see the insula. Remember that the insular cortex is going to be deep, as we can see quite clearly here, and that you're going to need to pull apart the lateral fissure and that frontal and parietal cortex in order to be able to see this deeper insular cortex. Here's a CT image of approximately that slice. Again, take a moment to identify the structures that we were just able to see on the wet brain. Again, going deeper, approximately another centimeter inferiorly, we can see now specifically the anterior and posterior horns that are no longer connected by the body of that lateral ventricle. And we can also see more of the thalamus and some more structures related to the white matter tracts. So here we have that anterior horn of the lateral ventricle with a septum pellucidum separating the right and left ventricle. We have our fornix. Recall that I told you that was going to be found on the most inferior aspect of the septum pellucidum. We can see that choroid plexus. It's in the body of the lateral ventricle, but it also wraps around and makes up the roof of the temporal horn of the lateral ventricle. So we don't see choroid plexus in the anterior or posterior horn. We do see it in the body of the lateral ventricle as well as on the roof of the temporal horn of the lateral ventricle. Here we really have a nice view of that most posterior horn of the lateral ventricle. It is the most pointed of the horns. More basal nuclei. Remember I told you the caudate and the putamen make that up. We can still see the head and of the caudate as well as the putamen with that anterior limb of the internal capsule dividing those two structures. Our third ventricle is getting larger here, although it's never really a large structure. It's relatively thin as far as the space goes, but we can see that opening up more here. And we can see the thalamus, and clearly that the thalamus on either side is going to make up a good portion of the wall of that third ventricle. We also can see another white matter tract here, the posterior limb of the internal capsule. And this is a really important white matter tract, but it pertains to what we were discussing on Monday in the motor and sensory overview. Recall that the thalamus, specifically the VPL of the thalamus, is going to send that third order axon up to the somatosensory cortex, and it does it through this posterior limb of the internal capsule. Furthermore, our primary motor cortex, upper motor neurons, have to send their axons inferiorly through the brain, and this is also going to happen through the posterior limb of the internal capsule. Finally, we can see more of that insular cortex, get a little bit of a better feel of this lateral fissure that's really helping us open up between the frontal parietal lobe and temporal lobe. Here's a CT image that corresponds approximately to that level that we just saw. Again, can you label all of the structures that we identified in the previous wet brain slice? And here they are. In this, we are quite inferior. We really can see now the temporal horns opening up. We're primarily seeing temporal lobe, a bit of the occipital lobe, most posteriorly, and some frontal lobe. We're going to see a little more of the basal nuclei. So there's that temporal horn of the lateral ventricle. And we can see the hippocampus, which the hippocampus proper makes up the floor of the temporal horn of the lateral ventricle. We can see here it looks very much like a jelly roll structure. We can see that third ventricle, quite large here, the head of the caudate as well as the putamen, but now we can see more basal nuclei structures, specifically the external and internal components of the globus pallidus. We can see the thalamus and the hypothalamus. Again, they're both making up the lateral walls of that third ventricle. And the posterior commissure, which connects the two hemispheres, but as I said before, is going to be the most posterior aspect of that third ventricle, with the anterior commissure making up the most anterior aspect. I don't have a CT image specifically of that view, so we're going to continue on. Here we can see primarily the temporal lobe, a little bit of the most inferior aspect of the frontal lobe. We can start to see more of the cerebellum, and we actually see the midbrain coming in here. So let's start to label some of these structures. We have that third ventricle, and also the temporal horn of the lateral ventricle. We've got the mammillary body, so again, the hypothalamus is going to be the most inferior aspect of the lateral walls. We can see some of those structures here. We can see the hippocampus, and as I said, that's going to make up the floor of the fourth ventricle, and hopefully you can appreciate that this is the hippocampus proper. This is the first image that we've been able to see my most favorite structure of the brain, the amygdala, which is important for emotion, reward regulation. I think we associate it more often with fear and anxiety. However, positive emotions can also come through the amygdala, and some of the learning and memory components related to emotional experiences. Here, I've outlined the midbrain, so let's identify just a couple structures there. We can see the substantia nigra, which is very important with its relationship to the basal nuclei. And we see a deficit in this region in individuals with Parkinson's. We can also see the cerebral aqueduct here. Remember, that's connecting our third ventricle to our fourth ventricle. And most posteriorly, we can see the superior colliculi here. We can also see the crus cerebri here, or the cerebral peduncles here, which is where our white matter tracks from the upper motor neurons are going to travel through the midbrain. Here is a similar CT slice at that particular level. Can you identify the structures that we just saw on the wet brain? And here we are. Finally, I'm going to end this lecture looking at a special 3D dissection. This is a dissection that we do here at EVMS, and we have several of these brains that you'll be able to look at, but we always have a faculty with them because they are very delicate. I think one of the benefits of this type of dissection is that we can see some of the structures a little bit better as we've taken away much of the cortex. The other thing is it really helps you to appreciate the relationships of the ventricular system. So let's begin. Just to get sort of our bearings here, this is the superior, what we consider intact version of the 3D dissection. We can see frontal lobe cortex here. Oh, we've got our white matter here. We can see temporal lobe coming around and a bit of our occipital lobe here, right? Or temporal lobe here. But we have our corpus callosum here towards the center, and note that the anterior is at the top of your screen and the posterior is at the bottom of your screen. Let's label a few more structures to help you to really make sure that you know where you are. So we have that centrum semioval, all that white matter traveling to and from the cortex. We have the corpus callosum with the genu, the body, and the splenium, so we can see 3 of the 4 components of the corpus callosum. We can also see the insular cortex. Now that we've removed much of the frontal and parietal cortex, we can really see quite nicely in a wet brain what the insular cortex looks like. In this image, we've taken away the frontal and parietal cortices and much of the occipital cortices, although there is a little bit left back here. We can see the anterior compartment of the cranial vault. And so really what this allows us to see is a superior view of our temporal lobe. Let's start off by seeing the most posterior horn of the lateral ventricle. Again, remember that's the most pointed part of the lateral ventricle, so we can see that it's a little more superiorly located here. And then, of course, we can see the temporal horn of the lateral ventricle. Again, this is a better image to really be able to see the hippocampus. And we can see, I like to say that it looks a bit like a Tootsie Roll here, but this is our hippocampus right here. Again, it's found in the floor of the temporal horn of the lateral ventricle. This is the hippocampus proper that I just outlined. Just medial to that is going to be the dentate gyrus. And then medial to that is going to be the subiculum right here. All 3 are very important in learning and memory, and we'll discuss them quite a bit when we get to brain-mind behavior in your second year. We can also see the amygdala, my absolute favorite structure of all time, and we can see very nicely in this view that deep to the uncus is where the amygdala sits. So if we look here, we can see this uncus, and then we have our amygdala here, and it's labeled on this side. So the uncus is a good landmark for knowing where the amygdala is located. We can still see the corpus callosum as we haven't removed that, specifically the body and the splenium components of that corpus callosum. Now, from the last image to this image, you have to imagine that we've taken away everything that we were just looking at and put back some of the structures that had been removed in that view. So again, here, this is the anterior aspect, so we can see this is frontal cortex here. Although a lot has been removed, right? We can see the white matter here and here, that white matter tract traveling to and from the cortex. But we've removed much of the frontal as well as all of the parietal, all of the temporal, and all of the occipital. And by removing that, we're able to see the posterior aspect of the brainstem, as well as much of the cerebellum here. Again, thinking about this view, we really can see more of the lateral ventricles and try and get a better idea of that frontal horn or anterior horn, which we can see here, and then all this body and what really makes up the boundaries of the body as it curves around to become the temporal horn. Let's start to identify some of the structures. We can see the septum pellucidum separating the left and right lateral ventricle, and of course anterior to that we can see the genu of the corpus callosum. We can see the caudate, and before in the horizontal sections I kept talking to you about the head of the caudate, but here we can see the body of the caudate as well. Both the head and the body are going to make up the lateral wall of the lateral ventricles. The tail actually wraps around towards the temporal horn of the lateral ventricle. And most inferiorly on the septum pellucidum, we can see the fornix, again that white matter tract that's going from the hippocampus to other regions of the limbic system. We can see that third ventricle, and I think here is the best place for us to really be able to visualize how very thin that third ventricle is. It's hard for us to imagine when we're looking at a hemisected brain, but here we can really see that it's just a couple millimeters across. Anterior commissure is going to be the most anterior part of the third ventricle, and posterior commissure the most posterior aspect. And then we can see the thalamus, and here I think they sort of look like big walnuts, but again, it really gives you an idea of the size of the thalamus and the fact that it is a big walnut or egg-like structure within either hemisphere of the brain. There are many different subnuclei within the thalamus. It plays a huge role as the gatekeeper, allowing information up to the cortex and sort of watching information coming from the cortex down as well as between the cortices. So it really is sort of the grand central station of all information, and then almost the bouncer to decide what information is allowed through versus not. In this, we've zoomed in more so we can see most of the cerebellum, although we've removed a component of that to see the floor of the fourth ventricle. We can also see a little bit of the anterior aspect of the brain and some of the posterior midbrain structures. So, just to get your bearings, we can see the thalamus on either side, those big walnut structures. We can also see the pineal gland there medially, and here, this is where that third ventricle is going to be before it travels through, or the CSF travels through the cerebral aqueduct to get into our fourth ventricle, which we can see here. We can also see on the posterior aspect of the midbrain, the superior and inferior colliculus. Again, we do have a left and right of each of them, as we can see here. And just inferior to the inferior colliculus, we can see cranial nerve 4, the trochlear nerve, which is the only nerve that comes off the posterior aspect of the brainstem, and it is very fine and thin in nature, very thread-like. I already told you we've got that huge cerebellum there. We've cut part of it out so that we can see the floor of the fourth ventricle, which we also call the rhomboid fossa. Let's talk about a few things within the floor of the fourth ventricle we want you to know. First, we have the sulcus limitans, which is going to separate the alar and basal plates. Remember, more medially, we're going to have motor components. More laterally, we're going to have sensory components. This relates back to Dr. G's embryo lecture that you just had. We can also see the facial colliculus, which is a bump that is created by the axons from cranial nerve 7 that are traveling around another nucleus. It creates a bump. Bumps in the brain we call colliculi, so here we can see that facial colliculus. Again, there's one on each side. And most inferiorly in this rhomboid fossa, and as part of the medulla, we can see the obex. Turning around what we just saw, so now instead of looking at the posterior aspect of the midbrain, we're now looking at the anterior aspect of the midbrain. Again, note here, we have the optic chiasm coming through, and then we can see the optic tract on either side. We can see the hole that was created by the pituitary stalk coming through there, and so of course the floor, which is the median eminence of the hypothalamus, we can see right here. Labeling some other structures that we've already identified either in a previous lab or earlier in this lecture, we can see the mammillary bodies there. You can see cranial nerve 3, cranial nerve 5 coming out most lateral on the pons. And we can also see that lovely flocculus component of the cerebellum. Adding in some new structures, that cerebral peduncle, that crus cerebri that we talked about, the white matter upper motor neuron axons traveling through the midbrain are going to be found just deep to these two structures. And then in between the two structures, we call the interpeduncular fossa, which is where you're going to find cranial nerve 3 coming out. We have a middle cerebellar peduncle. And this is going to be how information gets from the motor association areas, the premotor areas. Sends white matter tracts down to the pons, and then that information is going to enter into the cerebellum through this huge middle cerebellar peduncle that we can see on either side. Remember, there is a loop that comes back through the thalamus, specifically the VAVL of the thalamus, but that's going to head back up to primary motor cortex to help with that execution of and the fluidity of movements, of planned voluntary movements. At this point, we've looked at all of the structures that we wanted to identify today. This lab lecture was really about introducing to the horizontal sections and being able to think about imaging and the structures within imaging. It was also meant to introduce you to some of the ventricular organs or system, as I will be giving a lecture on the forebrain and the ventricles on Monday. Again, just to remind you of structures that we had already seen previously, maybe seeing them in a slightly different context, but allowing you to get that 3D idea of the brain and its structures and how they connect together.